Hello, you are watching News 9 Digital's Facebook Live with me, Amrita, and today we will be discussing about drug addiction. Now, drug addiction is recently in the discussion, mostly in the substance abuse about in various film industries from Bollywood to right here in Sandalwood. Now, the discussion, as we all know, has come forth after the death of Bollywood actor Sushant Singh Rajput and also actress Kangana Ranaut, initiating the debate on drug addiction. But what the reality currently is that the drug addiction is not limited to just film industries in India, and that it is a national problem that we are dealing with, and does not only limit to just rich people either. It also pertains to poorer people who are suffering from drug addiction. So, to give an example, in 2014, Kerala police submitted a report to a local court stating that schoolboys were getting addicted to whiteners, or the pen eraser that we commonly used in schools, and schoolboys aged just 15 to 18 years were getting addicted to those whiteners. And in 2017 as well, the Directorate of Education instructed schools to ban the use of these correction fluids, whiteners, as well as other substances in schools, right, for this reason as well. So what is the scenario like in India when it comes to drug addiction? So here are some of the facts. In India, it is reported that 3.1 crore Indians have reported using cannabis at least once in their lifetime. Moreover, the use of sedatives for recreational purposes, or more specifically non-medical and non-prescription use, has also been seen among children and adolescents. Other than that, India also records at least 10 alcohol or drug related suicides every day, and it is a fact that 1 in every 20 addict seeks medical help. That is only 1 in 20 addicts. So to speak on this matter, we also have on the phone line with us Ms. Sana Rubiana, counseling psychologist at a hospital right here in Bengaluru. Ms. Sana, thank you for speaking to us first of all.
Thank you for having me over.
Ms. Sana, my first question to you is the almost important question, is how to approach the topic of discussion on addiction with addicts themselves.
Right. So firstly, you can discuss something on the basis of helping someone only when they are open to it. Only when they understand that, yes, this is the time they need to understand there is some problem that they're dealing with, right? So you can only have that kind of discussion when you start to show more compassion towards the addicts.
Yes.
Rather than using punitive or unpleasant measures in order to get them off the streets.
Yes.
So the first and foremost thing would be is to show compassion, be kind to them, show them that you care about them through your behavior. Followed by that is you have to accept their addiction even if you do not accept the behavior. By that I mean do not criticize them or belittle them.
Yes.
Followed by, active listening is very important. So you listen more than you talk to them. You listen to their problem, their situation, what kind of insight, to what level they have insight into their addiction. And when you communicate with them, you have to show them consistency. If there is a certain thing that you do not like or you do not expect from them, that has to be told to them, on a regular basis, so they don't get confused in the kind of instructions you're giving to them.
Okay.
Right? So you have to support the process of change.
All right. So Ms.
And help them seek help.
True. So Ms. Sana, as we know that, not a lot of people suffering from different substance abuse actually seek help. So what are the things that could possibly stop them from seeking help, and how can you spread awareness that this addiction is going to become harmful in the later times of their lives and that they need professional help?
Right. So there's a lot of stigma and taboo surrounding this particular topic, surrounding this particular concern. And that is one of the major reasons why people, they stop themselves from going out and seeking help, because they're usually worried about as to how people around them would react. So we have to ensure that whether it's at workplace or education setup or at home, that you're providing them with that kind of unconditional love and care, and that you're there with them throughout the process of change.
So what we know right here, Ms. Sana, is that to come out of an addiction, be it
Right.
alcohol or any other drugs for that matter, it is very important for the person to have the support of his family and friends. So over
Yes.
here, a lot of things to learn and not to create a stigma surrounding this has got to do with the other people as well who are
Yes.
around the addicted people rather than
Right.
just addicts. So how
Yes.
will you counsel the people around the around those who are suffering from addiction?
Right. So caregivers and caretakers and people around the addicts have to be more emotionally and physically present for them. And at the same time, they have to, indulge in skills like active listening, helping them take actions early, avoiding any stereotypical, comments, or not judging them and not labeling them. That is somewhere we all can start with, is to avoid judgment, to avoid any sort of labeling. And especially for people around these addicts, have to set some sort of personal boundaries with them. Setting some sort of healthy boundaries with them by telling them, this is the kind of behavior we can put up to, and this is not the kind of behavior that we can accept and put up to. So setting healthy boundaries is crucial to any sort of relationship, and it's definitely crucial to even, having a connection and bonding with addicts.
So also, Ms. Sana, can you tell us about what are the harmful effects of drug addiction? Because people might think that using cannabis might be okay because it might not cause any side effects, but that might be a myth. And we do not know going on what kind of substances they might get addicted to. So can you also tell us how drug addiction exactly impacts life of a person?
Right. So drug addiction has effects on both mental as well as physical health. Now, how it affects a physical health, it starts with weakening your immune system, right? It increases the risk of illness and infection. It can also lead to heart conditions, wherein it increases the risk of heart attacks. Nausea and abdominal pain also becomes a very, part and parcel of their life. It also puts a strain on the person's liver, which increases the chances of having liver damage or liver failure. Individual drug addicts experience a lot of seizures, strokes. It can also lead to brain damage. So drugs alter brain chemistry, wherein it starts to hamper with the brain's performance as well. So these are certain, some of the physical effects of drugs. Now, drugs also have effect on one's mind and behavior. So paranoia is seen, aggression is seen, hallucinations are seen, addictive behaviors become a part and parcel of the behavior. It also leads to impaired judgment, clouded and muddled thinking. Impulsiveness is also increased, so they become more impulsive. And of course, it also leads to loss of control, wherein they don't really have control over themselves and others around them. It also affects unborn babies, right? They're born with defects. It can also lead to premature birth or also low birth weight. So like I've mentioned now, drug use has various different side effects and ill effects on both mental as well as physical health.
Right. Thank you so much, Ms. Sana, for giving us your insights on this particular topic, which is very sensitive. And it's not just the people who are addicted to drugs that need to note about the harmful effects, but also the people around those who are addicted to substance abuse. they need to also learn how to speak or how to discuss this topic with those suffering from drug addiction, because most of the times the social media impact or the trolls or people who might be speaking ill about drug addiction may make out the addicts as something as the other, as an outcast, as someone who's a villain. So doing that is basically counterproductive to getting the person who is suffering from addiction out of their addiction. So it is very imperative over here that we also approach the topic of drug addiction very carefully, because it might also cost the lives of those suffering from addiction. You can leave your opinion in the comment section down below. Also like, share and subscribe to News 9 Digital.